Hey everyone, thanks for checking out my YouTube channel. I'm Peter. This is an interview. If you are watching this means you are not listening to the podcast proper. This interview is part of an episode that I'm doing on chronic pain patients who are dealing with the opioid crisis and covering different aspects from the chronic pain patient point of view that most people, including journalists, are just not thinking of. This one I have here is with Lauen Deluca. She is president of the CIAAG, which is a patient advocacy organization. Lauen was great to meet with me. We're breaking some very interesting news here. Their organization put out a press release about a month ago, and it was a dossier that they had found and put together after researching where the where the CDC 2016 guidelines came from. Lauen was kind enough to come on and talk about the interesting experience she and her partners had when they were at the RX 2019 summit a few weeks ago, which President Donald Trump spoke at. And the conference talked a lot about the opioid crisis. This is really important. In fact, both the interviews I'm doing for my podcast episodes are important, but they both cover really important things in different ways. And this one covers where these regulations came from and why it will be so hard to get rid of this anti-opioid, anti-chronic pain patient point of view. I mean, you just look at the things that Lauen dealt with putting together the research document and then at the summit, and the attitude that she was given by officials. It's kind of scary. This one is more news breaking. So for these reasons, I really recommend that you share this with friends. Please also check us out at the proper podcast. Yes, the Happy Warrior podcast. We like to cover politics, culture things, nerd stuff, and then I like to do long form interviews with experts who know issues deeper, farther, faster, better than all the rest of us. And Lauen Deluca is just one of those people. All right, well, thank you so much for watching. And without further ado, here is Lauen.
The Happy Warrior Podcast. Conservative commentary on the news of the day from a more positive perspective.
I am here today with the president of the Chronic Illness Advocacy and Awareness Group, Incorporated, Lauen Deluca. They're an organization that is interested in the issue of the chronic pain side of the opioid crisis. They released a pretty comprehensive dossier last month called Violation of the Nation, which I highly recommend you check out. I was just reading that today to update myself on everything you guys are doing. Not only that, but they have been part of the reason why the CDC recently started changing on their guidelines. We'll talk about that in a second. Also, they were at the famous RX summit that was happening a week, 2 weeks ago, with where President Trump was at, and that was in the news. Thank you, Lauen, for being here and talking with us today.
Yes, thank you for having me.
Yeah, okay, so let's start with a little bit of background. So you are a chronic pain patient yourself, right?
Yes, I got actually injured from a medical procedure in 2017.
Okay, so that wasn't too long ago. And before that, you worked. What was it? Primarily in insurance.
I was a commercial insurance agent for about going on the better part of 15 years prior to that. And I initially had a pancreatic attack one night. I went to the emergency room, and I was actually not given appropriate care. And at the time, I couldn't understand why. And it really is what set off creating Chronic Illness Advocacy and Awareness Group, is I was forced to essentially fight for my life as the hospital handled me the way that the CDC said to. Not give me any access, send me home, tell me to breathe. And we can kind of get into that after that. Subsequently, the findings that we found in Violation of a Nation has fully explained to me why I was handled in that way. and why we now need to advocate even harder than we ever have before, because we understand what we're looking at.
Yeah, it's pretty fascinating. So for those who have never heard anything about this issue, back in 2016, the CDC came out, and that was kind of weird because it was the CDC. The CDC usually doesn't deal with this kind of thing. The CDC came out with these guidelines that, in words, said that you had to limit the dosage for pain medicine, narcotics, opioids at 90 MME, which is it seems fair enough on the face of it, but what it actually set was this precedent that where law enforcement and states and state legislatures are saying, "Oh, we're putting a stop on opioids," and they just ran with it, and that's kind of led to where we are today. Whereas, very interesting, when your newest dossier came out, it was just around the same time that the CDC admitted that they screwed up, forgive my language, and that what people are taking away from it isn't what they intended to.
Yeah, and we had delivered our dossier on April 8th in Washington in private closed-door meetings with, we had actually went over the course of 3 days with about a dozen offices, both Congress and Senate, and we went over all of our findings. And, April 8th it was presented. Within 12 hours, the CDC had finally made the announcement that people have been screaming for 3 years. Doctors, medical associations, to no avail, have been asking for this to happen. This dossier had been brought forward, and then, it seems everything kind of finally came to fruition, and we were being heard properly and responded to. And it kind of showed quite a bit that it's not that, the ability to help us is not there. It is the will to help us, and whether it is there. So it showed quite quickly how quickly they can respond to national things if they desire to.
No, it's
So it was an interesting kind of way it played out even for us, because we didn't anticipate to find what we did. We just knew that we were advocating and trying to help people. And then we knew what we found was it was so unheard of that I think it solidified a lot of things that people suspected but couldn't prove.
So I don't want to go too much into the dossier, but some of the stuff that you found was very interesting. It even goes all the way back to 2010, and it ties in with the efforts that were being made during the passage of the Affordable Care Act and the push for electronic health records. It's a very fascinating document. In particular, you talk about the Institute of Medicine. They came up with this document called Living Well with Chronic Illness, which is fascinating. It is a fascinating document because they have all these very interesting social engineering suggestions when it comes to health. They conflate. I mean, this is where we start to see the conflation of pain, like chronic pain and chronic illness versus people who have an addiction problem. You also see there's a lot of talk about how we can reduce the cost to society. That seems to be an overwhelming thing. The last thing I'd like to say I found very interesting about it was that is where the mindfulness training and pain acceptance stuff came from.
Yes.
I had always wondered that. It seems such a strange suggestion, but it has the roots there.
And it explained all of the stuff that everybody's been seeing and knows outwardly that this is nonsense. You don't promote meditation when someone has pancreatitis. I mean, of course, having coping skills is great, but that's not a solution to an organ that's failing. And the fact that it's being basically sold and marketed and being gaslit, that anyone who speaks anything scientific or reasonable is just dismissed. Well, now we understand why. It was a strategy, and that was probably planned as well as how they would handle pushback, because they were implementing a strategy, and it was probably considered growing pains of a business strategy. As somebody who was in the business field before I got hurt, I used to advise a lot of large businesses on their their strategies on the high level. So I think that's what gave me a lot of the insight into seeing what their high level strategy was. And I can understand it from a business standpoint, but from the implementation standpoint, it's been horrific, and they well know it.
That is very interesting that you have seen both sides of this. That kind of makes you a very interesting character as an advocate.
Yeah, I joke and I call myself like a hybrid.
No, I think it helps. I think people, especially on the chronic pain side, I think that the amount of pain people have taken from this, from the neglect and the illness that they struggle, I think that you get a lot of an attitude where it feels very conspiratorial, and it feels very much like, they're out to get you. And it's nice that you see both worlds. It helps you stay balanced.
Yeah, and it's harder to dismiss someone when they're talking a factual legal argument. A lot of this is big business. It's strategy, and it's really shameful that our public health has turned into strategy. And that speaks volumes to the problem as it is.
No, I agree. It's very frustrating. I live in the Midwest, in a state that has taken the guidelines very seriously, particularly our Attorney General. And I want to talk about the Attorney Generals because they came out, and this is a little bit infuriating. Okay, so here, I'll back this up. So the bunch of great people that talk about this field, Dr. Sattel, Jacob Solom over at Reason. I even read an article today at Jacobin Magazine. So, a lot of different people are covering it. But they're talking about, well, now the CDC guidelines have been rolled back, but very few actually have any idea when we're going to see the rest of doctors feeling safe enough to prescribe, because basically my understanding on the issue is until the D.E.A. at the national level and the states themselves, particularly the attorney generals, that won't be able to move forward. For example, the fun little, let's see if I can find it here.
I see what you mean. It could be until we see the follow through, it's an empty gesture.
No, so in the beginning of April, I found this interesting, and almost no one reported it, but Attorney General, and this is before the CDC puts out that's going to change the letter. So obviously some people knew that they were planning to do this. 39 out of the 50 attorneys general came out and said, the CDC, don't do this. You better keep those guidelines.
Yeah.
And it's worrisome.
It's very worrisome. May I interject? At the opioid summit that I was just at, where the government and the other stakeholders in the addiction industry and SAMHSA get together and they talk about what needs to be done to combat the opioid crisis. When I was down there, it was abundantly clear they're planning to continue to step therapy and take this medicine away. So, they're talking out of both sides of their mouths all the time with this, that they need to protect pain patients on one end, where they're saying that they're going to do something, but they're doing everything they can to remove access.
It is very frustrating. My own pain doctor, and I had to fight like heck to be able to see her, and she says, she has nothing against me. She follows all the rules and everything she's asked. She just doesn't feel safe at the moment to prescribe anything stronger than the tramadol I have, which is it's just frustrating. But I was lucky enough that at least she takes me seriously. Let's talk about the RX Summit. That is an interesting. So the RX Summit, for those that you don't know, is a big conference that law enforcement, people in the pharmaceutical industry, pharmacists, they come there and they talk about medical issues and goals that they want to have. And you and a couple of other members of your organization were there for this week-long event, right?
Well, we were intended to be there the whole week. We got cut off about halfway through.
Yeah, so let's talk about. So this is how your story got my attention, very interested, because it was very strange. So on what day was it, what day of the week was it when your what's the word I'm looking for? Your attendance at the conference got cut short?
We arrived down in Georgia Sunday, the day before, I think it was the 20th. And then we attended no problem. On Monday, I had, my big camera out right in front of them, recording all sessions, no problems. Actually, one of the speakers was even going to go have dinner with us, which, things happen throughout the day, and that didn't pan out. But there was no issues. We were very welcomed. The next day, someone saw me with the camera again, but this time I had asked a question, which we're going to be publishing that question shortly. Essentially, they had presented the results that they were doing a study. And they were very clear that they took 30 hospitals and they compared 30 hospitals where they told them to give out a certain amount of medication for certain procedures and to not vary. And they collected the results and they compared these hospitals and the results to see what should the proper dose be post-op. Well, that's engaging in a live human clinical trial on the public. That is not permitted. That's not basic science. They have point blank presented those results. And in any event, I used it as an opportunity to ask the researchers what they were doing to ensure, as they're collecting this data, that it was being done safely, to see, is the patient suffering? They're not tracking any of that. They're just tracking whether the patient, the healing process was the same. Did they get disabled? They're trying to prevent people from turning into long-term chronic pain patients, which is fine and good on the surface, but not at any cost necessary. And they're doing it at any cost necessary and using hospitals as literally laboratories. And you are going in as a patient to get surgery and expecting your doctor to help you and take care of you post-op, but your doctor has instructions from the head of the hospitalists saying that, you're only allowed to give them 3 days worth or 7 days worth, depending on the surgery, depending on whatever the variables there are. And the patient going back, asking for problems, saying that there's issues, the doctor has no control to be able to help you. And he knows that if he varies from that, he will lose his job and not be able to help anyone. So the doctors are being egregiously harmed as well. They're having to witness their patients suffer. So in any event, I go on a tangent about that all day. I just asked a question about suffering. We walked out, a woman had, a group of women had waited outside. My associate was actually waiting outside. They didn't realize we were together, and she heard these women saying some pretty vile things about me in general and saying how they needed to get me out of the conference. I had, exited the room. She told me to stop filming. I told her, I was allowed to. I attended last year and there was no issues. And I went straight to security because I could tell it was going to be an issue. And I reported it to security that it all happened. The head of the hotel came. The head of the conference came. One of the main speakers that introduces all of the other speakers, I forget the gentleman's name, all kind of surrounded me, apologized profusely, and said nobody would ever do that to me again. Well, that was until apparently they got wind of my name, because a few hours later, I was in a room videotaping, and excuse me, my cat. I was in the room taping and somebody just came in and called me and just kind of waved to me to come over. I followed them out and they asked, Miss DeLuca. And I said, yes, I confirmed who I was. And they said, can I see your badge, please? You are, your attendance at this event has been revoked. And I was just really confused and upset at this, obviously, but I kind of, wanted to just ask what was going on. We asked what was going on. He said, you've been taping, you've been asked to stop taping, and you continue to do it anyway. And I was like, what? That's not what's happening at all. I went to you and I asked you for permission, actually. And then we went over to the gentleman who we'd even asked. And, his whole body posture had changed. He had his arms crossed. He was, puffing out his chest. This gentleman is like 6 foot tall, way unnecessary to do, especially considering he had assured me of my safety just a few hours earlier. And then he said, that's not what I said. None of that happened. You are not going to be taping. Get out of here. And I knew I could feel they, these were not regular police officers. They had the equipment in their ears. President Trump was coming the next day. Secret Service had arrived in preparation for his arrival. This wasn't Secret Service that grabbed me, but it wasn't average hotel security either. So I, being as sick as I am, I can't protest and, really push it. If anything were to happen to me, I could get really hurt. So I chose, to do the right thing and just go to my elevator, to go to my room, because they were trying to get me to leave the hotel, but I had a room there. So I said, we'll go up to our room. We went to the elevators. They didn't get on with us. I actually expected they were going to, but they let the elevator go up. And then the elevator, somebody took control of the elevator and recalled it and sent it down to the basement. And then they sent it back up to the floor that we were on, which was the 15th floor. And those gentlemen had made their way up there. So they were just likely doing that to make sure they were up there before us. But it was just very highly intimidating. I mean, we're two disabled women just attending a medical conference. We got permission, and we just all of a sudden get accosted, and people are controlling elevators so that we can't go anywhere. They saw us into our room. Essentially, you know, they alluded pretty heavily to the fact that if they saw my face outside of the room, there was going to be some serious problems. So obviously, you know, two big guys with earpieces on. I'm a sick, disabled activist. I'm not going to push my luck. I just stayed in my room. And then, you know, in the middle of the night, someone had even sent cops to our room at 1 a.m. And they had stated that, you know, someone said that there was something happening in room 1508. So someone, you know, called it in with our room number, and no one knew our room number except for, you know, my associate's husband. So there was some very, there was quite the story of what was going on at the RX conference. And why would they go to such a limit? And why would they do that at all? And to such a heavy-handed level? Especially given what we had just done the week prior. It doesn't seem unrelated.
That is pretty fascinating.
Yeah, it was pretty intense. We had to literally like kind of slip out of the hotel as quickly as we could and get into another one, because my partner's key was decoded by the next morning. She went to get his coffee because I wouldn't go outside. And when she tried to return, she couldn't. So I let her in, and we kind of snuck out of the hotel. And that's, wow, like that is not what I expected from a medical conference. I attended last year, but I guess, you know, I wasn't, there was no issue with me last year. They didn't know who I was. Now they clearly didn't want me to see what was happening there any further. What I did get on film is highly damaging. And they are talking about pure illegal acts. And that conflate to market rigging. I really have no insider clue as to what would be all that, all those added security measures and phone docs. That is very strange. I mean, one hand. Agreed.
On one hand, I mean, if you're in charge of security for the president, I mean, I would give them a little bit of a break. But you guys obviously were no danger or harm. You
Exactly.
received permission to be there.
We paid $700 to be there. President Clinton was there last year. I actually talked to his Secret Service last year. I was chatting them up. There was no issue. But this year there was a major issue, and they found me by name and said, "You're not welcome here. Give me your tags." And, you know, I spent money on a hotel. We spent money, you know, my partner did. We flew down there. You know, we are chronically ill, so it's hard on us to do these trips. I save up my, you know, money and my energy to be able to go out, because I can't just fly around like a healthy person. I have to like really strategize my travel because I am ill. And, you know, they took this all away from our company. This was business. And we were trying to help our community and get the information that was happening there, and we were stopped from doing so.
No, I believe you. We have in my state, in my hometown, the two biggest employers are the two big hospitals. And my experience, I mean, the people that work there, the doctors, the staff, they're great. Love them. You know, they're just trying to do a good job. But there is some truth when it comes to healthcare. I wouldn't call it secrecy. It's just like this is official business for us big people to know about. And for you not to. Which is too bad. It's too bad. So you have plenty of these conference talks. You have some of the speakers on record. What are you guys planning to do that? Are you planning to release that in the coming month or something?
Yes, we're going to be releasing the footage in really bits and pieces, because this is a very complex subject. We've been researching it for several months before we came forward. There's a lot more information than just what we presented in Violation of a Nation. And, you know, our next job is really to educate everybody to know what we know so that they can take it, move forward, and advocate in their states. We have, at Chronic Illness Advocacy and Awareness Group, we have the 50 State Leadership Program, which is free. And what we're doing is basically creating that funnel of the proper information to get in front of advocates, because I didn't even know before we got into this, but in 2012, and I apologize, the name's escaping me, and they had passed the law to legalize propaganda. Now, why would the United States government want to legalize propaganda unless they needed to implement something they knew would require propaganda? There's a lot of stacked laws over the years that should be undone, and there's going to be steps that we're going to need to take with the community to undo some of these laws to get that, our basic American rights back. We're talking about freedoms, we're talking about basic social engineering that is deeming social warfare, saying essentially, if you hit the certain markers, you're going to get medicine. If you hit other markers, you're not. That's making a medical system that deems who's worth living and who's not. That's a major issue that could roll out into other movements, other areas, not just the opioid crisis. So this is now about protecting basic American human rights. This is much bigger than just, patients aren't getting one medicine. This is about keeping our American freedoms.
No, I think you're completely correct, because you can feel this, even people who aren't necessarily really aware of this issue. I mean, you can feel the tension right now between, if I try to talk to SD legislators in my home state, or I try to talk to our Attorney General, who used to be a friend of mine. I mean, there's a very strong tension between law enforcement, where one side says, we gotta get on top of the opioid crisis, and it's the people in white coats pushing drugs. And then you have on the other side, you have people who are people with chronic illness, or family members, friends of chronic illness, and they feel very much persecuted and feel like it's impossible to get medicine. I mean, I join them in those feelings often. It's a giant mess. And one of my problems I find with this issue is there's not really anyone that wants to own up to it, because it was during the Obama administration the Affordable Care Act was passed, and it was during their tenure that the 2016 guidelines came. But we just had Jeff Sessions, who was the top attorney general for President Trump. I mean, so both Republicans and Democrats have been just awful on this issue. So what has been successful for you guys when you try to talk to state and national legislators?
It varies state to state, the reception and, whether they're going to listen. Some states are, open and curious, and they want to learn about what's happening and try to work with their constituents. Other states are purely hostile in a way I've never seen. And it actually, to me, as somebody who did work in the business field, it's an unjustified hostility. So it makes me personally wonder, why are you so hostile about a topic? But nationally, in speaking with the federal legislate, they take it a lot more seriously. It has been a difficult 2 years in trying to get this message across. It's controversial. They don't want to hear it at first. And, they have heard a lot from the special interest groups that it was in their favor to continue to tell this message. They're profiting into the billions off of this continued messaging. And there's almost a level where we have to unbrainwash the information and bring in that realistic voice. But at the national level, the receptivity to listen is more there than at most state levels. I think even at the state level, there's a level of getting them to even believe that this is really the result of why this all happened. And once you know it from that aspect, that this was a law change that created this, that everything you've seen in the past 10 years has been created to structure a law change and to restructure the healthcare delivery system. It's a big, big business move. And once you take away the emotion, which is hard to do with a topic about chronic illness and suicide and overdoses and people dying and living in bad situations because they have substance use disorder. It's hard to look at it as pure business, but if you do, you can see what happened, and it's very easily something that can be fixed, but you have to have people willing to put their ego down and look at it. And that's where that's where I think, in my opinion, the advocates come in and start just reasoning with them and showing them the right information, because special interest has been paying them to take people out, go lobby to them, take them out to dinner, and show them this information in a nice, pleasant atmosphere. So it's received well, it's taken in at truth, and then they act on it. We've got 10 years of that we've got to kind of undo. And I think that they're receptive at the national level to do that, because at the national level, they take it much more seriously.
At least I hope so. All right, so if someone wants to get involved with your organization, they can go to your website, right?
Yes, the website's CIAAG.net. We're actually just launching. We've had state leadership since the beginning of the year, but now that this report is out, we know the game has changed, and we want to educate everybody on what really went down so that we can fix it and fix it together. And we're going to be putting out a lot of advocacy tools, webinars, things like that, to get people trained and involved as much as they can be. And we've designed it so that you can even advocate straight from your bed. You don't need to have money. You don't even need to be mobile. But if you have a little money and you want to print things out and go to a meeting, we will show you how to do that as well. So it's really it's advocacy at all levels for free to help you get out there, because in order for us to succeed, we need everyone's voice. And on this one issue, we can all agree. I don't want to be studied when I go to the doctor. I want to be helped. And I think everyone can agree on that.
Okay, excellent. Thank you so much. This has been Lauen Deluca of the CIAAG. And thank you so much for being here on the podcast. I wish you luck with your organization and your future endeavors.
Yes, thank you for having me. It's a pleasure.
No problem.